what are the prerequisites? What do you expect them to know in terms of their knowledge base, in terms of their softer skills? How much of hands-on experience, patient interaction, all of this that student can expect? What can students or what do program directors look for? Do a deep dive into your rotations. Good morning, good afternoon, good evening, everyone. Today we have a very special guest, Dr. Raheem, who has been helping a lot of Sarthi students in their US clinical experience. So we wanted to have an idea from him on what students actually learn in his rotations and how that is useful in the residency maths. So Dr. Raheem, welcome, and we are very glad you can be here today.
Thank you for me being here. Okay, thank you very much.
So, Dr. Raheem, let's start with a bit of a background about yourself.
Sure.
Tell us about you.
Yeah, I was born and raised in India, and I did medical school in India, and then for residency I moved to US 34 years ago. 30 years ago.
Wow.
94. Okay, 94. So
okay.
yeah, and I did here my residency. Then I did a fellowship, and then was in the chief resident, and then we'll do golden apple apart. Golden apple apart. Are you familiar with golden apple apart?
No.
Okay. Golden apple apart is the teaching kind of a award. Okay, is teaching kind of award. So this is with the University of University of Tennessee. I did from Golden apple apart for that year So that is and then we'll do initially I do inpatient, outpatient, things like that, and various times I did TMS also. TMS is transcranial magnetic stimulation.
Mm-hmm.
Okay, so so I did do that, and the school also school the child psychiatrist, being a child psychiatrist, will do school also but now over these years always I do various type of the settings but but now I can do outpatient psychiatry in 3 different clinics. So
Okay, so then when it comes to your rotations, let's do a deep dive into your rotations. So what does a student do in this 4-week rotation on a daily basis?
Sure. Okay, so mostly the clinic starts at 10 o'clock and get to 5 o'clock. Okay, so 10 to 5, and the clinics are on 3 different diverse patient population in 3 different areas of Chicago. Okay, so they have I work in diverse patient population and managing varieties of illnesses and psychopathology in different clinic settings. So one clinic is in in indigenous population, is and then one is student in 3 refugees population, and one is third clinic is from affluent patient so 3 different population
Okay, and how much of hands-on experience, patient interaction, all of this that student can expect?
Yeah, so they have a good good has hands-off experience. So what you do I will first do is the first I will interview the patient, and then after that this is the students one student every assignments we'll do one student we'll assign that to students, and we'll interview the patients and observe the patient, and this and then we'll do and till do, and after that we will do the present the patient the treatment and plan. Okay, treatment is the kind of like plan and assessment start like what is the diagnosis, like the patient say the diagnosis, and then we'll do kind of supervise with them. We kind of will the and then we'll I get the treatment. Okay, what is the treatment and what is the medications and what is the therapy kind of psychotherapy and kind of
Okay. So, what can students or what do program directors look for? Let's say the student has done these rotations. How are they useful for the match?
Yeah. So me as a kind of like chief residents, so we will do the kind of the what is the patient's like status, the patient status kind of is do all kind of like therapy appointments and follow-up appointments, and then we elicit sign. Okay, sign is the so that which like is like elicit signs kind of and symptoms. Okay, and then we'll do kind of the what is the like how comfortable the like the patients are with the students. Okay, so that is kind of that is the how patient, and then kind of whether the patient have like comfortable to talk to one-to-one situation. That's kind of important kind of
Right, right. Yeah, because I guess that is what the program
yeah.
directors are also trying to assess in terms of students' knowledge, in terms of their interpersonal skills.
Yeah, there's absolutely kind of interpersonal skills and like communication skills, things like that.
Okay. And last question in terms of before the student starts the rotation with you, what are the prerequisites? What do you expect them to know in terms of their knowledge base, in terms of their softer skills to be able to do well in rotations?
Okay, so they have to do kind of in this social skill patients. So we have good patient interaction kind of so and patient like students like good patient interaction, and then we'll do a basic sciences kind of so that is kind of the DSM kind of in DSM-5. Okay, DSM-5 we will do like sometimes like have to DM some 5 questions kind of so that is like what is like depression, what is bipolar disorder, what is kind of schizophrenia, so things like that, personality disorder, and and also medications. We'll do we provide medication management also, but we will do some like the like sometimes the generic name is different, like in like but brand name is like different kind of in USA, and other students kind of from like is the other students kind of India, Pakistan, like in like Europe, everywhere kind of all around the globe student come, so we'll have to do kind of okay. Yeah, that is the common factor to kind of making like sure the medications are good. Do you have to they are not familiar, then they can ask me kind of. Yeah.
Well, thank you very much, Dr. Rahim. This was very, very informative, and I think it'll help a lot of students
Okay.
before they start your rotation. So thank you. Thank you quite a bit.
Okay. Thank you very much. Thank you.
Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.